What's up, everybody? How are we? We're about 1 minute to 2 o'clock. We'll give stragglers just a minute more to get in here. We're going to have some fun today, everybody. Thank you for joining us. This one, we're going to have a blast. We're going to try to have fun. It's a crazy year, so we're going to try to lighten things up here a little bit. Raymond, thanks for joining. Courtney, what's going on? Good to see everybody. The chat box is open. I'm going to type a comment in here. Leave questions here. Let's see. Hopefully that's open to everybody. Let me make sure. Mail chat. Gotcha. All right, everybody. Assuming everybody can see the slides, I'm going to verify. Okay, everything looks good. How's everybody doing out there? Webinars are strange because I can't see you, like we were doing a live event. Pretty funny these days. We are in a COVID year. Speaking of COVID years, I wanted to do a poll that would be useful to both of us. I'm kind of interested. I'm going to open up a poll. You guys go over to the poll section here. And I've got special treats. We're going to do giveaways throughout this. You guys are going to have a lot of fun. I hope. Feel free to hit the poll section over there on the right. I want to know how patient volume is doing at your practice or hospital or group of any kind, I suppose. Welcome to the webinar here on PPC Advertising. Very much looking forward to hearing your thoughts and questions. We're going to make it as interactive as possible. Hey, Ina, good to hear you. Yes, it is a good day. We're going to have some fun today. Let's see, publish. All right. You guys go ahead and go to the polls. Go to the polls. Everybody's going to be hitting the polls this year, aren't we? And we won't get into that. All I care about is patient volume on this one. All right, guys, hit the polls. I'm going to leave it open for about 60 seconds. Say we're going to learn a lot of stuff. We're going to have some fun. Try to make these interactive. Guys, you'll all be emailed this presentation. So all the tips, everything's going to be in there for you all. So feel free I don't know if you want to take notes, but this is general strategy and everything like that. We're going to get very tactical though. I show examples of ads you're going to want to run. I show examples of landing pages, of copy, things to do, things to not do, campaigns I like, campaigns I don't like. We're going to get pretty granular here because I want you guys to have all the tips. I'm not a big fan of those webinars that keep everything high level and you walk away with no more information than you came in with. That's not fun. You guys need to learn something today and have something you can take back and implement this minute, okay? All right, so the polls are coming in so far, and it doesn't let me show you the results, so I promise I won't lie. I'm going to show you the real polls. Consider me USPS because we're going to deliver the truth this year. All right, patient volume has decreased. We're at 66%. Patient volume about the same, 33%. Patient volume increased 0%. Patient volume has not increased for anyone. 2/3 decreased, 1/3 about the same. Very interesting. All right, we're going to end that one. All right, thank you. Hey, Samantha. Hey, Rosa. What's going on? Camilo, Max, what's going on? Thank you for everybody joining. All right, guys, we're going to do a giveaway. I don't know if y'all can see this, so I took a picture. Here we go. Look at this. In honor of Jam Master Jay's perpetrators getting caught today, I had actually already had this shirt made, but I thought it was perfect. Sorry you got to stare at my ugly mug here, but I thought it was perfect. So the first person to tell us in the chat where they're from, where they're hailing from, I'm going to send a t-shirt out to. I got my marketing coordinator, Kat, checking out the comments, and she'll get one out to you. So we'll open that up, guys. We're going to do some random giveaways throughout this thing. Go ahead. Tell me where you're from. Tell us where you're coming from in the chat box, and we'll get this out to you. We'll get it out to you. Oh, there we go. Max is getting it. All right. All right. Ooh, Camilo from Atlanta. Sorry, I can't give you a preference, even though you're from Atlanta. I love it. Sorry. All right, Max, you're getting the t-shirt. Amy, I'll get back to you. Stephanie, sorry. There will be more opportunities. You know what, Kat? Send it to the 4 of them. So we're going to send t-shirts to the 4 of them. Sorry, Renee, I'm cutting it off there. All right, guys, a little bit about Cardinal before we dive in here. Hey, Mallory from Moultrie. I like it. All right, guys. So a little bit about Cardinal. We've been around 11 years. I started the agency, so I guess you can say it's all my fault. We're having a great year, outside of enjoying the great indoors all year. I know we're all tired of being in there. I'm in an office by myself. But We're doing the best we can. We're on a mission to get 1 million patients healthy. To me, medical marketing is marketing that matters. There's nothing more that I like than helping medical practices grow. Everything from a 2-location primary care to a 350-location behavioral health group, hospitals in between. So help just about everybody. If you can find your patient online, that's our business, and that's what we like to help with. Guys, by the way, y'all want a sneak peek? I've got a roundtable coming. In 2 weeks. We're going to be talking about COVID and how to thrive in it. This is going to be the giveaway in that one. I don't know if y'all can see. Look at this. Where are my Godfather fans? Can y'all see that? Yeah, buddy. So that's not for this one. We're going to do Run PPC, but that is coming up. That's coming up. All right. Let's get into it, guys. So what are we going to learn today? We're going to learn whether you guys should be doing paid search advertising. If you have been, what does it even mean to do Google Ads? What do we consider PPC? What are the best practices? And then what are campaigns we should be running? What are the campaigns we should be running? One more poll. I want to open one up. I want to run. All right, let's go. Go back to the polls. Are you currently using Google Ads at your healthcare organization? Everybody go polls. Let's answer it. I want to get a feel for how advanced we are on this one, if we're running it or not. And there will be a giveaway attached to it. All right, we're at 66% yes, 33% no. We're going to give it 10 more seconds. Yes. No. All right, I'm ending it. 5, 4, 3, 2, 1. Guys, 50% yes, 40% no. I love it. All right, good. So we're going to have a good mixture of stuff in here for everybody. I want y'all to be honest. The first person that hit the poll and answered, go ahead and put your name in there. Cat will get you a t-shirt out, okay? Be patient with us. It takes a while to get t-shirts out to here, and then we got to drop ship them over there. All right, guys, let's get into it. Tons of searches happening around the country for health-related stuff, symptoms, treatment, most importantly, provider-based searches, right? We're looking for providers now online. That's why it's so important to show up. No longer are all patient appointments coming from provider referrals. Tons of them are now coming directly from Dr. Google. So very important that we show up, and I'm going to tell you guys how to help you guys show up on Google, okay? What are people typing in? Well, they're going to their phone and they're typing in something plus near me. Imagine your kid gets sick. What are you going to do? You're going to pull out your phone and you're going to say urgent care near me. Well, this year you might be typing in telehealth doc. I don't know, but let's assume that we're in a non-COVID year. We got to prep for next year. Vaccine's coming. I think Moderna's going to get it done. Somebody's got to get it done. I've got to go to a restaurant and sit inside and get a meal at some point. We can't keep doing this. So anywho, everybody's searching something, whatever your specialty is, plus near me. And where are we showing up? You see those maps all the time. On mobile, the ads are showing up at the top. So you guys want to show up at the ads at the top, okay? What's the difference between SEO and PPC? We did an SEO webinar not too long ago. I think it was the last one we did. It was a few weeks ago, right? And SEO is great, scalable in a lot of ways, more cost effective in a lot of ways. You're not renting the ad space. You own the home instead of renting the home. Paid search is renting the home. If we stop paying Google, we kind of get kicked off. SEO is more owning the home, which is great. But there's a lot of benefits to paid search that SEO doesn't have. The first one being the ability to track campaigns. Google, about 6 years ago, got rid of the ability to track keywords through Google organic results. So you have no idea which keywords are driving patient appointments. We have no idea. But with paid search ads, of course, they let us know that data because they want everybody moving to paid search and not doing SEO. They don't make money off of us doing SEO, right? So with paid search, not only do we have a lot more data that you can base things off of, think about this. If you know which keyword is driving a patient appointment, then you can spend up on that keyword and drive way more appointments next month. Ooh, too much Coke Zero, Atlanta products. The other big thing with paid search and the advantage it has over almost every other medium is that it's bottom of the funnel. When someone is going to Google, think about the difference between Google and Facebook and other display types. When someone's going to Google, they're actively looking for a provider. Whereas on Facebook and all other types, billboards, out of home, we don't know if they need a provider. We're just serving them an ad because they hit a demographic targeting or a geographic targeting, whatever it may be. But paid search Google, we know they're looking for a provider. We show them an ad. The other thing is you can have flexible budgets, and you can have ads running in 31 days and driving appointments on day 32. And SEO, you can't really do that. I'm sorry. You can have ads running on day 1 if you do them yourself, but with agencies, typically you'll have a month of ramp up. All right, basics of paid search advertising. Guys, half of you guys have done search, so I'm not going to spend too long on the basics, okay? I don't want to bore the half that has been around, okay? A lot of it can be automated, but you want to make sure the strategy is right. If you leave it to the Google gods to determine how to spend your money, they're going to put all your money in display ads. They have tons of display inventory, and it'll look like your clicks are really cheap, but that's Google optimizing to the thing it wants, and that's not what you want. You definitely want a human running your ads, and make sure that you have that. What is the difference between PPC, all these common terms, right? We have a lot of synonyms: paid search, PPC, Google ads, search engine marketing, search engine optimization. Guys, when we talk about PPC, we're just talking about Google and Bing ads, okay? Facebook is paid social, and then over there on the right, you see all of these display networks. These are just demand-side platforms that run display ads for you, and you can run all kinds of different search campaigns on Amazon, Yahoo Network, etc. But when we talk about PPC, we are mostly just talking about Google ads, and of course, there's Bing as well, but I don't know about you guys. I don't really use Bing. Remember, you guys, you can put questions in. I'll check them. I'll check them every now and then. Danielle, great question. Is it worth investing in Bing ads? Does anyone use them? It's worth investing if you've maxed out Google. Certainly, the clicks are cheaper on Bing, but there's a lot less people searching. So a lot less people searching. Danielle, great question. Let's get Danielle out a t-shirt. Rosa, what's your opinion on being a better investment, SEO or PPC? I started a company as an SEO company, but they both have their place. Most SMB medical groups, they need to start with SEO, have the right content, and you should build ads on top of that, okay? But SEO is kind of the foundation. I think they're both great. Rosa, you get a t-shirt. Rosa, you get 2 t-shirts. Great question. Thank you. All right, man, we're going to give away a lot. I need to double the order. Okay, we're going to get them going. All right, when Google's asking you where you want to invest, they're going to ask you Google Search Network or Display. Very careful here, guys and gals. Display network is what I just alluded to. That's where they really make their bang for their buck. They're going to place your ad on all kinds of different networks, and you're going to show a display ad. That's okay, but it's more for brand awareness. I want you guys showing up in Google Search Network, okay? I want you guys showing up in the Search Network where people search for an orthopedic surgeon in Birmingham, Alabama. That's when you want to show up, all right? What is Display Network good for then, Alex? Why are you talking trash about it? It's not trash. My hospital's out there. I need to take off the question. I'll check back the questions at every moment or at every break. So put your questions in there and I'll check back. But I'm getting distracted. I think the squirrel keeps running in front of me. CEO is not good for a lot of things. Just good for getting scatterbrained. Display network, guys, really good for reaching new audiences and getting brand awareness there. If you want to increase population health, patient preference for your hospital network, things like that, display network's great. Display is pretty much the same as paid social. So you'll want to run the same kind of advertising on Facebook, potentially YouTube. And it's very different than the search network. Search network is going to be bottom of the funnel. That's showing up on Google with the keywords and things like that. Display network has its place, but guys, don't go to display network until your search is maxed out. Please, 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 okay? I want bottom of the funnel patience for you guys. What are the essential elements? All right, guys. Of course, Google wants to make money. So the number one thing that they're looking at is how much you're spending, how much you're willing to spend to get that click. How much you're willing to spend to get that click. That's always been number one. That's how they make money. That's how Google is the behemoth it is, okay? However, they also want a great experience for the user. So they're looking at the ad relevance and the ad creative and the landing page relevance. If someone clicks your ad, lands on the landing page, and then hits the back button immediately, they're going to have a negative experience on Google, right? They found content that wasn't relevant and they backed out. Google hits your quality score with that. We're going to talk about how to improve your quality score in just a few slides, but this is one of the big parameters you want to pay attention to. A quality score of 10 will pay half of what a quality score of 5 will be. So imagine you can be in the first position and be paying less than the second and third position on Google if your quality scores are better. All right. Guys, how do you get into Google Ads? I'm going to show you things in a second here about where to start with Keyword Planner, etc. Look at that tip there on the right. Look at that tip. over there on the right, negative keywords, okay? Negative keywords. This is just as important as targeting the right keywords. You want negative keywords in there. What is a negative keyword? You want to make sure Google knows what you want to show up for. That's putting the keywords you want to target. You also want Google to know what you don't want to show up for. And those are just as important. So every few weeks, to find out the keywords that people are finding you and you're paying for, now you shouldn't be, you should run queries in Google Analytics, Search Console, whatever you want. Google Analytics better for search. And you'll see the specific queries that people are using to click on your ads. And then you're going to find things that are irrelevant, like job, career, free. All of those are triggers. You don't want to pay for that kind of traffic. There's people looking for jobs, looking for, something for nothing. And you don't want to pay for that. Okay. So negative keywords, super important when you're building out these campaigns. I like Uber Suggest. A lot of people go to Keyword Planner. That's where I'd start because it has search volume and coupled with search estimator tools as well as cost per clicks and stuff. Uber Suggest is a new one. Neil Patel bought it and he runs it. And it's good though. And I really like it for SEO because it comes up with all kinds of different keyword variations. Great for search as well. Shows you what your competitors are bidding on that you should be thinking about too. I have the links in here. Check it out. He actually just pimped it out a bit further lately, so I think it's even more useful, but you can use all of those. Keyword Planner is great. Guys, this is where you would start. Keyword Planner, you go in there and you type in, hey, this is the type of services we provide, and then it'll kind of show you how many people are looking for you in your demographic, okay? Here's all the cosmetic and plastic surgery as an example, but if you're an ortho, if cardio, OB, whatever it may be, just put in your service lines and the geos that you're competing in. Then it'll tell you the suggested bid. I forgot to put this screenshot in there, but Keyword Planner has a great keyword estimation or conversion estimation tool now in there. So you go to discover new keywords and then discover, I think it's search volume and forecast. All it will ask you is what's your main service, and let's say you type in orthopedic surgeon, and then it'll ask for your location. Let's say you Atlanta, and then it's actually going to tell you how many leads it can drive. For what amount of money? How many leads Google can drive you for what amount of money? It's going to show you that. I'll give you a for instance because I got a lot of questions coming in about how much do I need to spend on paid search. A competitive service line like ortho will generally, in a major market like Atlanta, and we are a major market, Northerners, this is the real deal down here, we just talk funny, will run you about $1,000 a month. Major service line in a major market will run about $1,000 a month for one location. All right, guys? Medical clicks are still undervalued because there's still a lot of hospitals, there's still a lot of specialty groups and clinics that are not using Google Ads. So you don't have the same cost per clicks that you see in the law field where a click for a DUI lawyer runs $150. You don't see that in medical. The only example or kind of caveat to that would be orthodontics. Orthodontics runs kind of hot. You're looking at $400 a conversion, but Google will give you your conversion estimates and tell you how much. But that's generally what you can expect on Google. Use the conversion estimator tool. It'll tell you how many conversions you can get. All right, guys, we're going to keep matching along. In Google Ads, you can match to different things. I want you guys to be very careful. If you're going to build out your own ads, and I suggest you use an agency or a contractor. If you're going to build your own ads, I really want you to start small. If you go with something broad like eye doctor, Google will match you to anything that it feels matches that same word or otherwise. You're leaving a lot to Google to come up with, okay? The closest, the most narrow thing you can come up with in your paid search targeting is exact match targeting, okay? That means if you target eye doctor, you are not letting Google match you against eye doctor in Atlanta, eye doctor near me, none of that. You're just matching eye doctor. I suggest something in the middle, phrase match. Phrase match is beautiful because it matches before and after. You need to make sure that eye doctor is in there. All right, so check out your matching. You want your campaigns to be really granular. Google is moving to a new system, a bit more automated, guys, where it's going to do a lot of these things for you. I don't know if they're trying to get rid of agencies or they're trying to make spend more efficient so that they can get more of your dollars or make it more effective. I don't know. But a lot of these things it's going to start figuring out for us over the next few years. It's not quite there yet, so you have to intervene. Quality score. We talked about this measuring stick for Google, okay? Why does it matter? This is how they rate your ad and the quality of the ad. So something to keep in mind here, guys. You want your ad to match the landing page. Ad to match the landing page, and you want your ad to match the keyword. If all of that aligns, your quality scores will improve. You generally start out with pretty low quality scores until Google knows who you are. All right, let's back up here. Just 1 second. Let me attend to any questions. Yeah, so Google sent an email. Thanks, great comment, Amy. Google Ads sent an email notifying users who do targeted campaigns using specific demographics, including zip codes, that are being careful about this. The eye is on the big four advertising, big three advertising, Amazon, Facebook, and Google. All these privacy things, and you see Sundar and Jeff Bezos and Zuckerberg. They're all testifying before Congress, so they're tightening up the restrictions. Generally, Amy, what we have found is you can still get workarounds. You can still upload your patient emails and build lookalikes off of all of these things. At the end of the day, you're probably going to be able to get a workaround. We haven't really run into an instance where you couldn't. So I think we're still going to be okay. You definitely can still target by zip codes. If you weren't able to target by zip code, how would Google's advertising system make sense, right? Like they're going to show my ad for ortho to anyone outside of my area. It wouldn't make sense. Danielle, Amy, you get a t-shirt. You get a t-shirt. Danielle, great question. What are industry benchmarks for click-through rate? 1 to 3%. 1% if you're in the bottom, 3% if you're the first ad showing. We'll see. Organic gets about 15% click-through rate for the number one position. All right, guys. I want to open it up to a poll here. All right. I'm going to start this poll. I want to know, go to the polls. And the first person that tells me they answered gets a t-shirt, What's your biggest struggle with PPC advertising, guys? Are you finding that the click costs are too high? You're not getting enough leads, lead quantity or quality not good enough, or you just can't track the ROI? I need to know the answer because it'll kind of guide what I emphasize in this next part. All right, guys, right now we're at 25% click cost too high. 75% not enough leads. Keep coming, keep them coming. We're getting some statistically relevant data. You know what's interesting I'm seeing here, guys? All right, 5 more seconds. Keep them coming, 5 more seconds. See, this is the fun part of attending live. You guys get t-shirts. Nobody's doing anything live. They just sign up for the thing and then expect it to be emailed to them. No, we're not going to do that. We're going to keep doing giveaways and having fun. Maybe we'll do a Starbucks gift card or Amazon gift card next. I don't know. Maybe we'll do that. All right. I'm in the poll. Click cost too high, 33%. Not enough leads, 50%. Lead quality not good enough, 8%. Can't track the ROI, 8%. The biggest issue you all are having is there's not enough leads out there. There's not enough leads. That's so interesting. That is so interesting. I wonder if that's, you guys need to ignite the spend a little bit, or you need to venture out into paid social. Facebook ads are working really well for our clients. Maybe that's the next venture. If you guys are tapped out on your impression share, that's where I'd look next. If you're not getting enough leads, check your impression share. Are you losing anything out to rank or budget? Check that. If you are losing out, then you need to increase your budget or ranking, quality score. But if you're tapped out, I'd go over to paid social. I would check out Facebook ads. They're running really well. A lot of targeting you can do there because despite what Zuckerberg said, you can still target the heck out of people. All right, best practices. Let's have some fun, guys. A lot of you think you know your patient. You don't. You probably don't. I find that we think we know our clients really well, and when it comes down to it, we don't. This is a great year to get a refresher. It's a great year to get a refresher on what your patient cares about. Obviously, her needs have changed. She's looking for convenience. She's looking to keep her distance from us. She's looking for access in new ways that she never has. So it's going to change. And I would really suggest you dive back in your personas and interview patients, man. Interview patients. If you're getting any negative reviews at a practice or anything like that, interview patients. If you're getting positive reviews, but not enough, interview your patients. You got to know your personas because it influences how you build out your ad copy. How do you know how to build your paid search ad copy if you don't know your patients and what they care about most? Here are some great examples that are really succinct and alleviate concerns. I love these at the top that they're saying, hey, listen, this is going to be easy. We're flexible. Everything's portable. You're not going to need to travel. The comfort of home. All of these really resonate this year. Comfort of home. Do this from your home. Orthodontics have been great. They're really getting into the virtual consultation. You can send detailed pictures of your teeth. I mean, guys, if you can get braces virtually, you can do a lot of things.
Maybe you can't draw blood or get a full physical. Well, they can come to your house like the life insurance test people do. So make sure your ad copy is related to your personas, okay? We'll get back to the chat in a minute. Develop a seamless experience, guys. I don't know how many times. Remember we talked about quality score and how your ads need to match landing pages? If you're telling people that they can book online and that you have online appointments and this is the way you're going and this is the way, please, please, please make sure your landing page mirrors that. So important. And this is what I look for across the board. ThriveWorks doing a great job. Schedule online, matches the ad copy. Wow, your quality score is going to go through the roof because people are having a good experience. They're not bouncing back. And schedule online. And then it's really easy to schedule online. I can choose my appointment time. I can schedule how long, and I can input my information. Guys, there's plenty of scheduling tools out there that are HIPAA compliant, are going to merge with your practice management system or your EMR. And I even find some practices that are doing really well not integrating it. And they give some time slots. If they can fit that patient in, great. If not, the office manager calls back within 30 minutes and moves the patient to another time that day. So you don't have to have all this like complicated integrations and APIs set up, but you want to make sure your ad copy and your ads match the landing page experience. I would love to show you guys a landing page here that I'm a little partial to because Cardinal created it. But we want things to be really simple. See, what do we notice up there at the top? No navigation. No navigation, okay? We don't want people to have to dig for information. We don't want them getting distracted and going on site. All I have is phone number and schedule an appointment. Boom, okay? It's really big, okay? If they do want to go digging, I've got their address, location on GMB. I've got the providers that work there. I got all the locations, the services they have, and the pictures. Pictures showing really clean medical practices, right? That's important these days. And the phone numbers click to call. Guys, if you want an ideal landing page for your ads, this is, for me, this is wonderful. And we've converted really well with samples like this, okay? I don't get some of you hospital marketers out there. I love you. But you complicate the landing pages. You're driving them mostly to the pages that exist organically for that service line on your page, and you'll drop them just on the ortho page. I see it all day long. We don't actually create separate landing pages for your paid search campaigns. Guys, that's gotta be number one. That's gotta be number one. You need independent landing pages that aren't cluttered with navigation and make it real easy to book an appointment. You know something else I see with my hospitals? Not my hospitals, the other hospitals, the other agencies are running. No email forms. No email forms. Guys, like 50% of your patients don't want to call in. My generation doesn't want to call and spend 5 minutes going through prompts. You've got to find a way to get email integrated with some kind of call center or some kind of system in there. I know it's harder at a hospital system, but really tough. If you can't get to the fully booking an appointment online, I really want you guys to try to get the email set up, okay? We want to make it easy for patients to access our care. Phone, email, schedule online. Phone, email, schedule online, all right? Geo-targeting is super helpful, guys. Someone near me, look at this, look at this. This is a new ad unit that popped up in the last year, okay? Google My Business. It's typically an organic SEO, whatever you want to call it, free service from Google, right? We show up there and it's a free thing. Well, Google wanted to monetize it. So they said, we're going to show ads in GMB, Google My Business. And lately they did. You cannot specify that you want to show up in GMB alone. However, you can run search ads and then it will prioritize based on someone's proximity, whether they should be served that ad. So very tough to get it specifically for GMB. But if you do run ads, hopefully they'll show up there if they're geo-targeted. So would really advise it. You want to show your ads only to specific zip codes around your practice, your hospital. This depends on how rural your practice is, or if you're in an urban area, 2 blocks in New York and Manhattan for some of our groups to 20 miles in Arkansas. Some call it Arkansas. So geofencing is really fun. Geoconquesting, not sure if any of you guys are doing this. This is for my hospitals out there. This is fun. Tough to do for smaller medical practices because your competitors aren't big enough. But basically what this involves is showing ads to anybody whose IP address lands in a certain area. So if you're a hospital and you're competing against another local hospital for certain service lines, whatever it may be, let's just call it brand awareness. Serve ads around that hospital's area with pictures of people waiting in long lines, et cetera, and use your value prop, 15 minutes and you're in to see a provider. something like that. I'll let you come up with a ad copy, but this works really well for hospitals. Geo-conquesting on the display network works fantastically well. Guys, I want y'all to use all the call extensions, all the ad extensions that you possibly can. And there's a bunch of them. Call right directly from Google. You want to make it easy. So have the click to call in there with a call tracking number, my friends, call tracking number. Make sure you got a call tracking solution like CallRail. That's our partner here in Atlanta. We think they're the best. HIPAA compliant, once again, integrates with Salesforce easily so we can track campaigns. So I definitely want you guys to be using calls and call tracking. Access to the email. You can find locations, directions, all this kind of stuff. Use the extensions. It helps you occupy more space. In fact, if you're the first position on Google in the ads, they'll generally have your general text ad, and then they'll give you two big blocks, so you really dominate things. Hope your ads are honed in because you're going to spend a lot. You're going to get a lot of attention. There's all kinds of different things you can do specifically for healthcare. I want you to focus on the location ones. I want you to focus on the location site links. Very important, right? Post-COVID. We're assuming, I think majority of our clients are seeing patients in person once again, and 85% of their patients are coming back in. Only 50% are opting in for the telehealth consults. So I think people, I don't know, maybe we've all accepted that we're going for herd immunity in America. I don't know how this became this thing, but we're ramping patient volume back up, and most people are going in person. So make sure your location extensions are really clear there. All right, let's take a second. Let's go to the chats. We're going to give out some t-shirts to good questions here. Tim, I think you asked this question back on the last poll. Could it be that search volume is low due to the pandemic? Yes, absolutely could be. That could be why there's not enough leads. I think that's actually contributing to it quite a bit. Elective surgeries are down. Shoot, they were just completely restricted for a number of months there. And I think generally people are apprehensive to go in, or have been in previous months, to go in and see their PCP if there's nothing super emergency about it, to go into an urgent care unless their kid like tore their ACL. So yeah, I think search volume's low and it's going to ramp back up. You know, what I want y'all to focus on, Tim, you're getting a t-shirt. Great question. What I want y'all to focus on is next year, post-vaccine. Okay, this year's a slog. I know budgets are reduced and everybody's nervous, but I don't want y'all to be nervous, okay? We're going to get the vaccine and things are going to spring back into place, okay? And I don't know what you think about the presidential election, but when there is resolution to this election, that's going to be coupled around the same time as a vaccine. I'm optimistic, maybe. Around the same time, and you're going to have this explosion of buyer and patient confidence, and you're going to see things come up, all right? So I want you guys to work on your ad campaigns and your SEO and your reputation, all of that stuff this year. I want you to invest in those things this year. And I want you all to run Google ads this year. And you may not be able to up your spend or anything like that, or blow it out of the park and increase patient volume 25%. You may not be able to do it, but your ad campaigns will be optimized. Your quality scores will be phenomenal. So 2021, when the cork is popped off, we can hit the slingshot and we're flying again. We're flying and you're beating your competitors because you were working on it this year. All right, mobile, guys. Mobile's super important. That's how people are finding you. They're pulling this thing up. You have mobile bid adjustments. There's all kinds of fun things you can do on mobile that you can't do. So that can get really tricky. I want landing pages. I keep going back to landing pages, guys. Your creative is becoming just as important as your ads, okay? A lot of people have figured out paid search and SEO for that matter, and paid social, and they're figuring those things out. A lot of people have figured it out. So the running of the ads is almost commoditized. The experience you create is not. So the landing page is being optimized for whatever screen size someone is in. Is super important. So please check your landing pages. They need to be optimized for whatever tablet or phone. I don't know if anyone uses tablets anymore, but whatever device someone is on, they need to be optimized for that, okay? Woo. For me, I'm in B2B. Mobile's not that important. Most people are finding a new agency on their desktop, and they'll go type in healthcare marketing agency, and we will rank #1, hopefully. But when they're finding you, patients are looking for care. They're generally doing it on this for low acuity services, okay? My high acuities out there, your oncology, your cardio, your ortho, those kinds of things, you might still be on desktop, okay? So I need you advertising on both. But urgent, PCP, dental, mobile, super important, okay? My low acuity stuff, they're going to be finding you on their phones, okay? What types of campaigns should we invest in? I'm going to show y'all. For me, We're going to run through everything from remarketing, brand awareness, and what to use and testimonials and things like that. For me, what I want y'all to start on, for my 40% that have never run Google paid search ads, I want y'all to start by targeting your patients at the bottom of the funnel. What does the funnel mean? Imagine a funnel's like this. Patients start to learn about you up here. Can you see the twinkle fingers? The spirit fingers. The spirit finger. We'll call them spirit finger. And then patient learns about you because they type in, I've got hip pain. Okay. I've got hip pain. I'm doing more research. Oh, crap. Maybe I need surgery. Hip surgery options. Ooh, I'm at the bottom of the funnel. I know I need a provider. Hip replacement surgeon. That's where I want my newbies to be, okay? I only want you bidding on bottom of the funnel keywords because they are the most likely to convert. Most likely to convert. I do not want y'all bidding on treatment-based stuff or even provider names if not fully necessary, or informational things. Let the Mayo Clinic, let WebMD, Mayo, shout out to you, Mayo. I think we got 3 or 4 Mayo clinics. They have one of the best SEO programs out there. Rank for a ton of stuff, and they have a lot of information. Google trusts them. Let them rank for that stuff. You guys show up in your local areas for your bottom of the funnel keywords. I'm going to get to the chat in a minute. I see a few popping in here. Everything, all of these bottom of the funnel people are ready to convert. Make sure your URLs are simple. Your display URL can just say exactly what you want. It doesn't have to be the actual URL. You want to educate people on the services. And the number one thing this year, please, 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 is to advertise that you do telehealth or teleconsults or your second opinions on MRIs or can be done virtually, assuming they have their MRI. That is so important. And like I said, 85% are coming in for our clients that we've seen, are still coming in, but you want to make sure that that 15% are catered to, okay? What kind of promotions should we run? Oh, no, I'm in healthcare. We don't run promotions. We don't run promotions. Not true. You definitely do run promotions, and you should make sure everybody knows about it. Which way are you going to go with it, guys? Are you going to use the offer in the headline? Are you in LASIK? This can be a big deal. It's the discounts. I love my honest LASIK providers because it doesn't change when you actually go in there and they find astigmatism in your right eye. It stays consistent. Remember, reputation matters too. So your ads should be reflective of what will actually happen. But include the offer in the headline. Other examples, guys. New patient visit. My dentals, my orthodontics, my chiros out there. Shoot, my spine surgeons. Lead with a discounted patient visit, especially if you're cash pay. Lead with a discounted visit up front so you can get people in the door. This is big in chiro. I see my dentists have done it. New patient consult. My orthos can do it. Free initial consult, $100, something like that. Obviously, braces $4,000. So you want to get people in on kind of a discount. Make sure it's really prominent, and make sure, once again, I can't tout it enough. Phone number, address, everything very easy. Stephanie Alves, great question. We got a question for a peds office. What should we focus on? General peds? Well, are you general? Yes. That's tricky because it's a lot of ailment-based stuff. We don't find that our peds offices advertise too much. I mean, really, that one's tricky. You're going to want to try, you really want to be provider-focused on a pediatrician-based search, like pediatricians near me, pediatrics near me. And then you can get into display campaigns where you're targeting people that are in the hospital. Like here in Atlanta, Northside's a big baby factory, okay? And we would target, if you were here, I would tell you, run display ad campaigns around this hospital here because they're a baby factory, and serve them with ads talking about your peds office to get them in there when mama has her baby. We decided on our baby. They made us decide when we had my recent baby, Lucas, who started walking 2 days ago. That was crazy and scary. And the blockages on the stairs went up like the next day, which thankfully was in time. But they asked us in the hospital, who's your pediatrician? We said, we don't know. So we started Googling it. Pediatrician near me. We found one there. We're serve display ads. So guys, pediatrician near me, you can go the provider route. I always say go the provider route. Someone looking for an orthopedic surgeon, dentist, those are all good. Michelle asking, what type of promotion would you recommend for home health care? Ooh, Michelle, we have the largest home health and hospice group in the country as a client. Paid search working really well. Be publishing a case study soon on that one. Paid search working really, really well. SEO works really well as well. Tons of home health keywords, hospice keywords to bid on. It is fairly competitive. Cost per leads in the $150 to $250 range. All right, Michelle, you get a t-shirt too. Let's see who else we got. One more. Stephanie, could I target three specific hospitals? We are on board here. Could I target 3 specific hospitals that we're on board? Can you give me more clarity on that one? If you're talking about display, yes, absolutely. Tim, you already asked a question. I'll get back to you in a minute. Okay, buddy. I'll get back to you in a minute. All right, guys. Remarketing. What can we do with remarketing? We're in medical. Doesn't Google ban all of the remarketing ads? Short answer, no. Long answer is I'm going to show you what to do. All right, guys, there's 2 types of remarketing you can do. The one that you're most familiar with, let me get a sip of this energy juice here. The one that you're most familiar with are the display ads. When you go shopping and you put those Cole Haan shoes in your shopping cart and then you leave the site because you saw your wife found you buying more expensive shoes that you don't need because it's pandemic. You dip out of that site really quick. And then all of a sudden on Facebook and everywhere else you go, there's this ad for Cole Haan shoes following you everywhere. And you're like, damn it, how did this happen? That's remarketing. And yes, you can do it in healthcare. Okay. So you can, RLSA is what it's called in search. So if someone comes to your landing website through a paid search ad or otherwise, any way they come, you can serve them ads on Google Search Network so that you show up again when they go back. If they go back to Google to look for an orthopedic surgeon and they had landed on your site, they'll be served your ad once again. And we have a Peds Dental ad there that are happening right there. So yes, that's the way that most people are familiar with. I'm gonna get back to the Q&A in a second, guys. Be patient with me. Remarketing ads you're most familiar with. D4C, there we have them there. All the kids dentistry. This is what you're most familiar with. The big thing I want y'all to remember on remarketing for healthcare is you cannot imply a condition. You cannot imply a condition. All right, guys. So if you're an oncologist, you cannot say, come back to our cancer specialist, or thanks for visiting the website. Or, imagine if you found out you had cancer and haven't told your family yet, and they come log on your computer and then they see all these ads for an oncology specific service line or something like that. That would be tremendously bad, right? So you cannot imply a condition, and you can't use conditional language, but you can do a lot of things with remarketing, which are great. You can also serve ads on Facebook. Highly recommend. These are going to give you some of your best cost per leads out there and great brand awareness. Someone's already been to your website. Make sure you're showing them ads. What do I want you guys doing for paid search on a budget? Well, I want you guys to run brand awareness in very specific ways. All right. If you're going to run awareness campaigns on search, I only want you guys doing it for a specific few reasons. One, you're opening a location, something I didn't put on here. Opening a location, or we have a new MD starting that has some credibility and people will actually give a hoot about coming to the practice, okay? This is for my rural guys. Oftentimes a new MD coming can be big news, and that's great. Or you've got new services or products that you're offering, okay? Otherwise, please, search is not the right way. It is not where I would be spending my time running brand awareness campaigns, all right? Display is where I'd run them. It's like remarketing, but we're serving ads to people that haven't been to our site yet. I love these from MD Anderson. I don't like the cross through the cancer thing. It's hard to read, and I can't find it. But anyways, you can do a lot. You can upload your patient data, patient email list, build lookalike audiences, which are great. It can help you change the perception or increase service line attention. Like, we have a great hospital here in Atlanta, Grady, level 1 trauma, and Bertie Marcus, the founder of Home Depot, he invested a lot. I think it was in their oncology group and cardio group. And they've run all these campaigns about, I wouldn't be here without Grady. And it's totally changed the perception of Grady from a level 1 trauma center to a hospital that also helps with big cardio issues. And so a lot of that was done online. You can't run around without seeing an ad. You see them on the billboards in Atlanta and stuff like that. So this can be a great way to get some new brand awareness. By the way, I didn't put this in here intentionally, but I interviewed the CMO of New York Presbyterian, Hernando. His family is also from Spain, where my father's side is from. And the interview is on our healthcare marketing podcast called Ignite. Go to Cardinal, you'll find the podcast, or just type in Ignite Digital Marketing Podcast. Great interview with how New York Presbyterian has changed the brand focus and how they run their advertising. I recommend it. We've got a great podcast out there, not just webinars with fun giveaways. All right, guys, testimonials are huge. Not only do I want testimonials on your landing pages, and they should be video. Please don't do them in text. They should be in video. Definitely want them in video, but the video should also be all over your paid social ads, your Facebook ads. Remember, we got to go to Facebook. We're not getting enough leads out of Google PPC. Search volume's down, like Tim said, but also we just need new channels. We just need new channels, okay? So really important, have the testimonials. You know something else I really like for you guys to have in your ad? Provider testimonials. I don't know about you guys, but if I'm going to get my spine worked on, I probably want to meet the provider, right? Even if meetings online. So please get your provider videos honed in and get them online, okay? And then once again, on your provider pages, on your hospital or your clinic page, you can have the provider. I love to have the provider video on there. Make sure you have a video, not just the picture. And then link out to the health grades profile. Link out to the GMB review profile for that provider. I love that kind of stuff. You want to control the conversation, okay? Let's not land people on provider pages where we don't show the reviews, where we don't show them talking to a patient, where we don't show the patient talking to us. Control the conversation, okay? All right, testimonials are big. You can use them in your search campaigns as well. It's big. I would love for y'all to get really quantitative with the care you provide. Let's give some examples. Let's say you're an ortho clinic, helping over 100 new patients through second opinions every month. Survey says 4.9 average rating on health grades across all of our providers. Please use specific and quantitative measures. All right, guys, testimonials, just more examples, okay? Alleviate fear, build trust. Alleviate fear, build trust, okay, guys? Remember, do not imply service line-based stuff. You'll get kicked off the GDN. Some of these ads are running on ad roll. All right, guys, we've got some more questions and giveaways. Stephanie, you got 3 hospitals that are main doctors see newborns there. Okay, yes. So what do you do for targeting? Basically, I'd run ads, make sure that, does the doctor have her own practice where they're seeing newborns? That's where I'd be running the ads too. And yes, absolutely. If you're talking about display ad campaigns for geo-conquesting, yes, I would serve ads at all 3 of those hospitals and talk about how your doctor is the best one. Absolutely, I would do that. It's really cost effective too. Remember, Google wants you on the display network. So Stephanie, let's get you out a t-shirt. Camilo, Northside super expensive. Learned that the hard way a couple of weeks ago. Hey, I had a baby there, and I can attest to helping pay for their super expensiveness. All right, guys. Analytics. All right, I'm going to give you a sneak preview into the PPC 202 webinar we're going to do in a month. And once again, before you all forget, all you wonderful people, we had over 100 registrants, great healthcare marketers around the country. This is what's going to be on tap and our roundtable. CMOs are going to be joining us. We're going to talk about how to thrive coming out of COVID. It's going to be awesome. We're going to be promoting the heck out of it. Big giveaway, Starbucks gift. You know what? Do y'all want to do some Starbucks stuff or Amazon? I don't know. You guys tell me. We're going to do some serious giveaways here in a second. All right. First giveaway. Go to the chat box. Go to the chat box. Who here, and be honest with us, is tracking patient data back to their CRM platforms? Who has CRM implemented, Salesforce preferably, and then who is tracking marketing campaigns back? Go to the chat. Let's see who's doing it. First person, give us a response. And remember, you guys said that tracking ROI wasn't a big deal in the poll. So let's see who's doing it. Go to the chat. This is big, guys. Tracking your data is really possible, okay? You can link Salesforce with your marketing campaigns like Facebook and Google to be able to tell how many people are coming to your landing pages and then how many of those people end up becoming patients. But it requires you to have a CRM like Salesforce. And a lot of practices just aren't there. Hospitals are trying to get onto it, but it just takes time. It can be expensive. But if you want to know the ROI and you want to get down to it, it's great. We have a technology called Patient Stream that integrates Salesforce with your marketing platforms, give you an ROI. All right, shameless plug. Moving on. Guys and gals, that's about it. That's all we got today. Let me get to some questions. Tim, you're planning to do Salesforce. Guys, if y'all need great Salesforce reps, that's great. Let's see. Who's Max? You already got a shirt. That's good. Danielle, great. Danielle, $20 Starbucks gift card for you. $20 Starbucks gift card. Kat will get it out to you. Michelle Adams, thank you for letting us know the truth. That's honest. Let's get you out. You tell Kat. T-shirt or $20 Starbucks gift card. Up to you. Y'all even want Starbucks because we have to stay at home? I don't know. You tell her if you want Amazon or if you want whatever you want. A little bit about Cardinal while we get some more thoughts. Get your questions in now, guys. We're going to get kicked off this webinar thing in 10 minutes anyways. Get your questions in now. Cardinal, my agency full of the most wonderful flockers. We've actually doubled headcount this year. Had a great year. Revenue up 40%. Client count nearly double as well. So really fortunate. Really fortunate and having a lot of fun. Some growing pains, of course, but getting through it. SEO, paid search, Facebook advertising analytics. That's what Cardinal's been known for. Typical onboarding lasts about a month, and then you kind of grow from there. Amy, great question here. What is your go-to CRM? HubSpot is good. It's cheaper. It's good. The marketing platform more expensive. But we prefer Salesforce. Salesforce totally HIPAA compliant. Anything you plug into Salesforce becomes HIPAA compliant. It works really well with the majority of platforms like CallRail and email tracking and jot forms and stuff like that. More scalable. It's got a service side too in case your office manager or whoever call center is taking your inbound calls. You can go with the service stuff. We love Salesforce. We're one of their premier healthcare agency partners. I do lots of speaking with them and stuff like that. Great case studies with those clients. So we love the ability to track. I would go with Salesforce. Great question. Get them in, guys. Get them in. Get them in. I hope y'all have fun. Did anybody have fun today? Gabrielle, good to see you again. Quentin, what's up? We're going to be talking soon. Good to see you there too. All right. Ashley, thanks for joining. Thank you for joining. All right, we got chat here. You're welcome, Samantha. No worries. No worries. You're welcome. All right, guys. I'm going to give y'all Elementor, Camilo. I think we use Elementor for landing pages. Some are hand-coded, but Elementor. Quentin, thank you for the kudos. That's good. I hope it was good. We're going to send this out to you, but you're about to have the best agency in the country, so you don't have to worry about it. You're welcome. Plenty of Coke Zero, Tim. Guys, we're going to send this out. My personal emails, I'm sorry, this is a default deck slide here. It is A as in Apple, M as in Membrillo at Cardinal Digital Marketing, AM at Cardinal Digital Marketing. You can reach me direct if you want to chat with me or any of the specialists at Cardinal. They're a lot smarter than I am, and they can definitely help you out. All right? That's it, guys. Hope you enjoy the rest of the day. If you have any questions, shoot them out. All right? Brought you 9 minutes back. I'll see y'all at the round table. 2 weeks. 2 weeks. Amy, most bang for the buck for a free clinic, SEO. Send me your URL and I'll take a look at your clinic for free and give you some ideas. All right, guys, that's it. Send me any personal emails, am@cardinaldigitalmarketing.com. See y'all.